His question was, one of the risks after having a hip replacement is dislocation. Yes, that's probably what's the second most common problem after hip replacements. The most common cause is leg length problems. And in my opinion, it's almost always female patients that have the problem. And the reason why there is a leg length discrepancy is because when you do the surgery, you do your very best to make the legs the same length. The hip, one of the ways to stabilize the hips is you have these big tendons called your abductor tendons, and they keep the hip from dislocating. When you cut the neck out, you cut out some of the important stabilizing structures of the hip. It doesn't matter if you go from the front or the back, what approach you take, you will destabilize the hip in one position or the other. If you do an anterior approach, the hip is less stable from the front. If you do a posterior approach, it's less stable from the back. But the short idea of it is to make the hip more stable, sometimes you have to lengthen the leg a little bit to put more tension on the abductor tendons to keep the hip stable, to reduce the risk of dislocation. So what normally is the case is it's not a real leg length discrepancy, it's what we call a perceived leg length discrepancy. Over time, arthritis grinds your hip down, and the bad hip becomes shorter. You may not realize that, and when I see you in the office before surgery, I show you this. Look, your leg is shorter. Do you feel shorter? I feel tight and I feel painful, but I don't feel short. So in the time of an hour when I do the hip replacement, I'm doing my very best, and I'll get an x-ray to make sure we're just about even if we can. I lengthen you back out to what you used to be, and your mind takes 6-8 months to catch up to the fact that I've now made you even, because you were thinking you were even all along. So that's what the most common problem after hip replacement.